There are a lot of videos out there talking about the core and how the core works. Some of them are good, some of them are not so good, and some of them are just downright garbage. I want to clear up some of this confusion. So in this video, I'm going to talk about the anatomy of the core and how it actually works so that you're able to better cue your athletes, program for your athletes for improved results, and reduce risk of injury. Before we talk about activating the core, we first need to talk about the anatomy involved. And there's a lot of muscles that are involved here, but the ones that we want to focus on are what I call the primary muscles of stabilization. And that's going to be the diaphragm, the three muscles of the abdominal wall, and the pelvic floor. Now, the diaphragm is going to sit in between the chest cavity and the abdominal cavity. It attaches to the bottom four ribs. It attaches to the spine and the back. And it's a dome-shaped muscle that when contracted, it's going to actually pull that central tendon down towards the pelvis, which, as you're going to find here in a second, is critically important to activating your core properly. Next are going to be the three muscles of the abdominal wall. You've got on the outside, you have your external obliques, which is going to go from the rib cage and it's going to pull down and in. They're going to attach to a tendon in the middle called your linea alba. And those pull the rib cage down when they activate. The next layer down or in is going to be the internal obliques, and they're going to go from the pelvis up and in, again, meeting at that linea alba. So we've got the external obliques pulling down and in, the internal obliques pulling up and in, and then finally the deepest layer of the abdominal wall that gets a lot of attention is going to be your transverse abdominis. And that's going to go from the spine and wrap horizontally around the abdominal wall, again, inserting into that linea alba in the front. Now, we talk about the transverse abdominis quite a bit, but you really want to think of the abdominal wall as functioning like a corset that connects the rib cage, the spine, and the pelvis all together. And it's important that we have each of those muscles because they can pull and create and control motion in all the different directions. When you only have muscles pulling in one direction, or if we only had just the transverse abdominis, our ability to actually create and control motion of the torso would be severely compromised. So we want to have that corset of muscle fibers pulling in all directions so that we can actually move the way that we're supposed to. The last muscle in the primary muscle of stabilization, or the last collection of muscles, is going to be your pelvic floor. And the pelvic floor is going to be a diaphragm-like structure in the pelvis that connects all of your three pelvic bones. And the pelvic floor is going to be opposed on the opposite side of where the diaphragm is. So the diaphragm sits here, the pelvic floor is there, and that sort of then wraps around. So if you think of it like a container, you have the diaphragm on the top being the lid, the bottom of that container, that can, would be the pelvic floor, and then the wall of that can is going to be the abdominal wall. And that container, we can actually, by regulating the activity of the diaphragm and the opposing trunk musculature, is the way that we can stiffen the trunk by creating intra-abdominal pressure and activating the core properly. To properly activate your core, you first need to be able to create an outward pushing force in your belly. And that force is created by contraction of the diaphragm. So the diaphragm sits in between your chest cavity and your abdominal cavity. And when you contract it, it pulls its central tendon down and it creates an outward pushing force because it's essentially pushing the abdominal contents out against the abdominal wall, down against the pelvis, and most critically, back against the spine. That's the foundation or the cornerstone of a good brace. So the first motion is that outward pushing force. The second activation is going to be those muscles that we talked about, the abdominal wall and the pelvic floor, resisting that outward pushing force. So when you're activating the core, you're not tensing your abdomens, you're not sucking your belly in. What you're doing is you're creating an outward pushing force that then synchronizes and activates all the muscles of the core into one solid contraction. So that's how you properly activate it. Now, it's not just pushing your belly forward like a lot of people think. What this is doing is you actually want to create what we call circumferential activation or circumferential expansion. You should feel the abdominal wall move forward, laterally, and backwards. And in the next video, I'm actually going to show you exercises that you can do to learn how to brace properly and how to train the brace so that you can train this skill in your athletes and your clients. Because bracing properly is as critical and as essential as hinging, pressing, pulling, and squatting.